This morning, Japan is declaring a state of emergency ahead of the Tokyo Olympics. That state of emergency starts July 12th and lasts through the Summer Games, which could be bad news for fans living in Japan. Foreign correspondent James Longman is in London with that story. Good morning, James.
Yeah, good morning, Diane. We've now heard it confirmed the Olympic Games will be held under a state of emergency. It's pretty extraordinary to think about. It's the decision that Japan's Prime Minister announced earlier this morning. He said that bars, restaurants and karaoke parlors that serve alcohol must be made to close. He said it was to prevent the future spread of the virus. No areas where people can gather and to celebrate when watching the games, largely probably on television because they may not even be allowed to go. All this is due to go into effect Monday and it'll last through the games to August 22nd. Now, cases in Japan do remain relatively low compared to most countries, but they are now rising exponentially. But crucially, only 15% of the population has received a vaccine. So I think this is why there's so much concern that if foreigners come into the country during the Olympics, the possibility for then a spread to people who haven't been vaccinated is very much there. The authorities have been under pressure for months to cancel the games. People just don't want it to go ahead. And while it was hoped that some spectators would be allowed to watch, it's now possible that members of the public won't be allowed into any of the events. As part of his press conference, the Prime Minister was talking about how important television would be inside Japan. People have to stay at home to watch. He doesn't want people going along to the Olympic Games area. Now, this is as the Delta variant surges around the world. The Japanese are afraid of this, and it is now dominant, according to the World Health Organization, in 92 countries. The majority of those places where people are dying seem to be in South America, but it is in a lot of other countries as well. Russia has had a huge surge in recent months. But experts are saying that vaccines do work, even against the Delta strain. They're saying it's very important that people get their vaccines as soon as possible. And there is a disconnect between countries in Western Europe and the United States who have quite good vaccine rollout and parts of the developing world that just don't. So countries across Africa, Asia and South America have seen very poor vaccine rollout. The World Health Organization is saying people there must get their shots as soon as possible. Diane?
All right, James Longman from London. James, thank you. Let's go to ABC News medical contributor and infectious disease specialist, Dr. Todd Ellerin, for more on this. Dr. Ellerin, what do you think about Japan holding these Olympics while under a state of emergency? Is it safe?
You know, Diane, I'm really feeling for them right now. You know, you have athletes and coaches who have trained for years, an unpredictable and highly contagious virus, and really an increasingly skeptical public. So I do think that some of the principles that they're using is likely to keep things safe. Masking when you're indoors, they're going to be limiting movement, but they also want no cheering, no hugs, no high fives. You just get that sense of, well, what is it going to be like? So I think the most important thing is what James had pointed out. Less than 20% of the population has received a single dose, and less than 10% of the population has been fully vaccinated. The key right now is increasing that vaccination uptake as soon as possible.
Now, the Delta variant is now dominant in 92 countries, including the U.S. So what does that mean from a practical standpoint when you look at the world trying to fight this virus?
Right, we've heard this already, and in the U.S. and the world, it's really a tale of two countries, essentially. You've got the vaccinated people, where the vaccine really works well in keeping people out of the hospital. It may be reduced a little bit as far as getting infected, but it really does amazingly in keeping you out of the hospital. For the unvaccinated, it's really a problem. You're likely, if you get infected, increased likelihood of spreading it to other people, and potentially an increased likelihood of getting hospitalized. So I just think it's the same message we keep saying over and over again. Please roll up your sleeve.
Well, on that note, the White House has sent a COVID surge response team to Missouri because of an increase in cases likely due to the Delta variant. But the governor there, Mike Parson, writes on Facebook, quote, sending government employees or agents door to door to compel vaccination would not be an effective or welcome strategy in Missouri. What do you make of that? And if that's the case, what's the best approach?
You know I disagree with that, Diane. I mean, we cannot let politics divide a public health response. I mean, we want to deploy CDC epidemiologists, people that will help with public health communication, contact tracers, individuals that are going to help with vaccinations in a state that has the #2 highest rate of cases. And let me be clear, while we were seeing evidence of herd immunity before the Delta variant hit, right now cases are going up. We absolutely do not have population immunity against this variant. So I just think let people come in and help. It just makes sense.
All right, Dr. Todd Ellerin, always great to have you. Thank you.
You too, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.